Hey everyone, welcome to today's talk show Beyond LASIK, the rise of ICL and IPCL vision correction by Malaysia Kini's Health Matters. I'm Thiviya, your host, and I'm super excited to have all of you here. Before we kick things off, let me give you a quick intro to the star of today's show. Phakic intraocular implants, as they are often called ICL or IPCL. Think of these implants as contact lenses that you never have to take out or clean. They sit comfortably inside your eyes, giving you crystal clear vision 24/7. Yes, even in the morning sometimes. It's like having a permanent HD filter for your eyes. Right, so today we are diving deeper into these game-changing lenses, and to guide us better, let's give a huge round of applause, virtual round of applause, and welcome Dr. Norazlina Binti Bachik Ng, the Clinical Director of KPJ Center for Sight. Hello, Doctor.
Hello, Thiviya.
Hi,
Hello,
Doctor. How are
everyone.
you?
Hi, I'm good.
All
Hope
right,
you're
looking
good.
forward to, I'm good, I'm doing very good. Looking forward to speak to you more. And Doctor is here to share her expertise and tell us how these implants are changing the lives of so many people. That's not all. And I will also hear from someone who has experienced this life-changing procedure firsthand, and will be getting their real life take on what it's like to see the world through a new lens, literally new lens, all right? So grab your coffee, everyone. Grab your coffee or tea, whatever that keeps you going. All right. Sit back and let's dive into this eye opening session. All right, Doctor, to begin with, right, I just want to jump right into our first question. What are phakic intraocular implants, and how do they differ from traditional intraocular lenses? Please enlighten us.
Okay, thanks, Thiviya. All right, let me start off with giving you all a bird's eye view of what refractive surgery is all about, okay? Because talking about phakic intraocular lens implant is part of a refractive surgery. Okay. As you know, refractive surgery is the procedures or surgeries that we undertake or we do on eyes to correct the refractive error. Yeah, and we can do this via three modes. Let me just show you on this eye model.
All
Yeah,
right.
I hope you can see this well. Now,
Mhm,
one is we do on the cornea called the cornea refractive surgery, and this entails surgeries like LASIK, if you have heard of it, and the
mhm,
latest, which is the flapless one, is the smile,
mhm,
relaxed smile, or
mhm.
the advanced surface ablations. Okay. Now, the traditional intraocular lens implants that you asked me just now entails replacement of our natural lens, which is in the eye. Where
Oh,
is this lens placed? Is actually here behind the pupil or behind the iris, the black portion of the eye. Okay.
okay.
Now, in phakic intraocular lens, this is a procedure that comes, I would like to describe it as in between for people who are not suitable for the corneal works or the corneal surgery, but they are too young to have the lens replacement because the lens, the natural lens in the eye is still not cataractous. Yeah.
Right.
So, but they do have very high refractive error, for example, and not suitable for the corneal refractive work. So, what
Mhm.
we do in picking intraocular lens is putting a contact lens in the eye, and where exactly in the eye is actually in between the natural lens and the black portion of the eye, which is your iris. Okay,
Mhm.
that's how it's called contact lens. It's just a placement. So we need to get this terminology right. It
Right.
is not lens replacement because we are not replacing anything here. No, all your natural, original, so to speak, eye organs is still there. We are just placing a contact lens with the power to suit whatever refractive error that you have.
Right.
Okay.
It's like an implant. That's why we call it
It's
implant.
yes, it's implant because basically something outside we're putting it inside. So I'm going to show you this model of this implantable contact lens. This
Okay.
is how it looks like, yeah?
Okay.
Both for ICL or IPCL. Now, the difference between these two is just in the material, yeah?
Oh,
And of course, different producers of the lens, yeah? So this is how it looks like. The power, whatever power that you have, whether it is short-sightedness or is it to correct far-sightedness, is all placed within this zone. This is called
Right.
the optical zone. And the plates around this is just to hold it in place. And
Oh,
no stitches whatsoever is involved here. It's just holding it up, putting it in, releasing it in, and then that's it.
all right. Moving forward, right, Doctor, I also like to know who are the ideal candidates for phakic intraocular implants. Is there any specific conditions or eye issues that make someone more suitable, less suitable for this procedure?
Yeah. When you talk about refractive, I would like to always go back, your question to the refractive surgery age group, yeah? They must be of a certain age.
Mm,
Why? Because when they are younger, the refractive error is still not stable. It's still changing year by year, yeah? And how fast the refractive error changes will depend on their visual activity and how well they take care of their eyes. Now, normally we will wait up to the age of about 18
mm-hmm.
years old, which means after SPM, yeah, in our country, or for some a little bit later, about the age of 20. But they must be stable, or rather, the refractive error must be stable for at least 2 years before we can actually do. That's the safest way to approach this, yeah.
Mm-hmm.
Um, Now, between the age of 18 to when? To the age where you have other problems in the eye. So, for
Mm-hmm.
example, cataract. In our people, the lens on our natural lens will start to age because of age again, yeah, and exposure to sunlight and things like that. Normally, the changes will start at the age of 50 and above. So, for me personally, I tend not to do any LASIK procedures on people above the age of 50. So, they must be normal. The eyes must be normal. The eye pressure must be normal. The natural lenses must be normal, and the cornea must be healthy. Okay.
Okay.
Yeah. And particularly, who will benefit most from this is those who are not suitable for corneal refractive surgery. And like I said earlier, they'll be too young to have the lens replacement done. So you're talking about maybe those who have a power of more than 10 diopters here, or in layman term, we say, in the thousands, 1,000, 1,000 plus, even 2,000 or even 3,000. Yeah. I think
Yeah.
my highest that I've done is close to 3,000 power.
3,000.
Yeah, that's 30 diopters there. Yeah. So,
Wow.
yeah. And also, if you have astigmatism, so this can all be treated.
All right.
Yeah.
So all these are suitable candidates, that can look for doing phakic intraocular implants, correct?
Yeah. Whatever it is, the eyes need to be normal. Normal, except that they have refractive error.
All right. All
Yeah.
right. So what does this surgical procedure for implanting a phakic intraocular implants entail, doctor? What does it include?
It's actually quite a very straightforward procedure. But having said that, it's a very steep learning curve for the surgeons. Yeah.
Mm.
Because we are moving into a very normal eye, not a diseased cornea, not a diseased lens for that matter. And we are going to place it against, in front, right in front of the natural lens. So we need to be
Existing
very,
lens. Yeah.
yes, yes,
Very
yes.
careful.
Yeah, I still remember, the first procedure I did last time, my heart actually stopped 10 beats. I suddenly,
I think what you mentioned is very true. You are actually going into an eye that's
correct.
perfectly normal.
Yes, yes. But having done so many, you find that no, you got to perfect your skill because you got to help these people up. And it's a very acceptable and very, to me now, it appears to be very gentle procedure, seriously speaking. So what does it entail is actually making two or three tiny step wounds, yeah? And these are not big wounds. The biggest wound is actually just about 2.4 to 2.75 and millimeter. It's not even a centimeter. That
Yeah.
is the main passageway for the lens to go in, right? And we
Mhm.
do have two more smaller incisions at the sides for the instruments to go in to help tuck it in. So
All
through
right.
the big wound, we will have to fold my tiny little lens here. It's not this big, of course. So we will have to fold it in, put it in an injector, and then go through the tiny wound to place the lens in the eye. All right.
Oh,
So when I release it, it will just open up like that. It will take this shape.
it will place. Yeah, it will place itself.
Yes, it will just take shape. And then just nicely, we are going to go in and then tuck in the legs, or rather the plates here underneath the black portion of the eye or the iris. Yeah. Well, in
Right.
the older method or the older design, some are actually placed in front of the iris.
Mm-hmm.
That is also called the phakic intraocular lens. Yeah, but maybe we'll talk about it sometime later. But in order to prevent any abrasions or any trauma to the natural lens, we will coat the surface of the lens
Mm-hmm.
or the whole chamber or the whole area where we are going to implant the lens with what we call a viscoelastic material. This is just like a gel sort of material
For safety purposes.
to absorb,
Purposes. Yeah.
to act as a buffer, to prevent any rubbing against the natural lens. Yeah,
Mm-hmm.
and after this lens is implanted and tucked in nicely, and if you have a toric lens, meaning the power to correct your astigmatism, we will have to place it nicely on the axis where it should be. So having done that, we are happy with the position. We are just going to irrigate out the gel that we put it in,
Mm-hmm.
that we put in earlier. And that's it. There is no stitches whatsoever that is involved here. So we will do one eye at a time. One eye is done, you're okay, and then we move on to the other eye. So both eyes are done at the same sitting.
Right, right. Okay. But when it comes to a surgery, I'm sure there could be or possibilities are there for risk, you know. So what are the risk and potential complications that we can look forward to that can be associated with phakic intraocular implant surgery, doctor?
Yeah, I'm gonna start talking about this risk by this with this statement. No, there is no surgery in this whole wide world that is risk free.
Yeah.
Let's just put it that way. In fact, if you want to, get rid of your pimples or whatever, that you still can be some a risk to it, right? The bleeding, infection, and things like that. So naturally, when you talk about putting things into the eye, we are going to have to think about the possibility of infection. Number one,
Mm.
right? Infection, because now the eyeball is exposed to the world. God has made it such that the eyeball is enclosed, no link whatsoever to the external world. And now we have made a tiny wound there. This tiny wound can be tiny to us, but to the bacteria, is
Mm.
the highway there, right? So you've got to be very careful with hygiene and things like that after surgery to prevent infection. And of course, this has got to be done under sterile technique. So it's not a clinic procedure. It has to be done in the operating theater, yeah, with a
Mm.
sterile technique, all the instruments being sterilized and things like that. Now, that is number one. Hardly ever, if you take care of the hygiene, that's not a problem, but still a risk, yeah. Now, risk number two is actually, if you remember what I said, we're going to put it very close to the natural lens
Yeah.
in the eye. So again, the risk of actually traumatizing the natural lens is there. That's
Mm-hmm.
why you've got to be very careful. And most of the time, we surgeons don't breathe. Even if the heart can stop, it will just stop for
Just
a
look at
while.
the eye.
Yes, yes, we don't blink, we don't breathe, we don't move. Only the fingers go in and to make sure that, everything is in order. Now, then you can imagine once we have put something in the eye,
Mm-hmm.
that space become a little bit crowded. Okay, if I can explain it this way, if you have one tiny living room there, you want to buy big sofas, right? The 3+2, and everything will be a little bit crampy after that. Am I right? So
Yeah.
like that. So it's a huge space there. When you've already put something in there, it becomes a little bit crowded. So that will result in a little bit of how do I say, disturbance to the movement of the or the flow of the water within the eye. All right.
Okay.
And that can lead to high intraocular pressure, high eye pressure from within the eye. Now, eye pressure is something like our blood pressure. Now, blood pressure is in the blood vessel. The eye pressure is within the eyeball itself.
Mm-hmm.
So because of this crowded sort of situation that we have induced, that
Mm-hmm.
eye pressure can actually go up a little bit. And of
Mm-hmm.
course, definitely immediately after surgery, within a week or so, the eye pressure can shoot up because remember I tell you the gel that we put in during the procedure will take some time for the eye to actually remove it from
Okay.
that chamber.
Okay.
So that is why patients will be given, eye drops and tablets and whatever to help reduce the eye pressure, right? Now, the
Right.
other thing that we need to monitor is another possible risk is that the corneal cell count. You remember I showed you this one. I'm going to show you again. Yeah, this is the cornea.
Mm-hmm.
That's the transparent layer with in front of the eye, the inside lining of the cornea. These are
Mm.
lined by cells. The
Mm-hmm.
outside lining are not disturbed. It's the inside lining. Sometimes the inside lining cell count can actually drop. So we do have to monitor how
Okay.
many cells there are in the cornea. Definitely before surgery to decide whether the patient or this particular person is suitable or not. And definitely after that.
A lot of post-surgery.
Or possibly, yes, yes. Because if should the endothelial cell count drop below a
Mm.
certain level, we have the option of actually explanting the lens. Yeah, because it means that the eye is just not taking the lens well. So
So there is an option. If it doesn't work, then you can explant it.
that's the wonderful thing about the PIOL is this phakic intraocular lens implant is that it is reversible.
Hmm.
Reversible. This is that when I remove it out, then you get back your power, right? And that's
Okay.
it. And then you're going to think about, other options of clearing your vision out. Well, you go back on
Right.
glasses or contact lenses or even, LASIK. We don't
Mm-hmm.
know. Okay. Yeah. So
Right.
that's basically the three main risks that are involved lah, in a
Mm.
PIOL.
Understood, understood, doctor. Thanks for sharing. Right. In terms of technology behind phakic, right? And how do you think the technology has evolved over the years when it comes to phakic intraocular implants?
Yeah, Phakic intraocular implants has actually been around for many years, yeah, for some time. It started off with, very awkward, very odd designs, and very crude, for that matter, and it's placed in front of the iris, and
Yeah.
some are actually clawed, it's clipped on the iris, therefore, ending up with a lot of risk, a lot of complications for that matter. But over the years, they have actually improved a lot in terms of the material of the lens, which is more biocompatible. Yeah, which means that it reduces the risk of the eye rejecting the presence of the lens, and then of course the design. It has become such gentle design, I would call it, and which you just need to place it and nothing else. You don't
Mm.
even have to clip on the iris anymore. So no issues of trauma to the iris, no issues of this high eye pressure, bleeding, and things like that. So it has actually evolved, and if you read about the phakic intraocular lens, you're gonna see these two things
Mm.
or two types. Yeah, it's called the ICL or the IPCL. A lot of people, get confused about who is IPCL, who is ICL, right? ICL came first.
Okay.
But the difference between these two is, besides the name, is the material.
Okay.
One has got an animal origin, the other one is just polymer. So, in terms of patients who get these things implanted in the eye, some issues there in terms of the one with animal origin, yeah, which is the ICL. So, if that's what you see now, the trend is uh, before there are not many Muslims get this sort of implant, but then with this IPCL, which is non or animal origin,
Mm-hmm.
or polymers, and more the Muslims are getting it. Yeah. So
Right.
they have
Wow.
come up with nowadays. I mean, the latest is that they have come up with the ICL has come up with a statement to say that no DNA, no animal DNA is detectable at the end of it lah. So
Mm.
again, the option is there. So I'm as the surgeon of a refractive surgeon, I'm actually very happy because now our options of treating high powered refractive error is so much more now. So if you can't do this, you can do that. Can't do this, you go ahead and go to you start off with the front first, and then you can't. You just go backwards.
Right.
And if the age is nearing the cataract age group, then maybe you can talk about lens replacement instead of doing any of these things.
Understood.
Yeah,
Understood.
yeah. And the other nice thing about this intraocular PIOL,
Fun. Mm-hmm.
IPCL for that matter, they do have a lens which also incorporate the reading portion. So it's very, very handy
Mm.
for people who are already above 40, because that's when we get old. Yeah, life starts at 40. So the reading ability goes down
Yes,
after you reach the age of 40. I'm also experiencing myself. So between that 40 and the 50, or at when you develop cataract. So it's
mm.
a very difficult age group here. You know, you want to go for LASIK, you already have this reading problem. You want to do the lens replacement or put in a multifocal, you're too young for that. So
Yeah.
IPCL presbyopia is really, really very handy. So you get to correct your far distance vision as well as give you back the reading
Right.
ability. So wonderful. Yeah.
All right. So, in terms of other vision correction methods that's available, right, doctor? How do you think phakic intraocular implants improve the vision quality when we compare it with other correction methods?
Yeah, you gotta approach this question by understanding the other methods of doing correction, vision correction. Yeah. When we talk about, I'm gonna start with the cornea. So
Okay.
when you do cornea refractive surgery, you are actually changing the curvature of the cornea, right? So anything original, when we touch or when we change, there is going to be a change or a disturbance to the quality of
Mm.
the function of that particular part of the eye, right? So in terms of a cornea, you're gonna have a lot of this glare halos and whatnot, yeah, the dry eye issues and things like that. Now we go further into the eye and you talk about lens replacement. You are replacing what God has given you. Taking out the original, putting in a man-made one, yeah. So
Yeah.
man-made things, no matter how advanced we are, unfortunately, it cannot match the original. Close, but really not 100%, yeah. Almost there, but it cannot
Yeah.
be 100%. Yeah, there will always be this
One or
not to
two.
say
Not.
abnormalities.
Yeah.
Yeah, imperfections, I would put it that way. Yeah, it's only up to the brain to be able to adjust to any of these imperfections, right? So when you talk about this and that, front and inside, we have one of these methods which is in the middle. You don't touch the cornea and
Mm-hmm.
you don't replace your natural lens.
Mm.
So if you can just think logically, it will negate off all the problems that we have in relation to the cornea refractive work and not giving you the problems with the lens replacement. So in
Mm.
terms of quality of vision, it is definitely much more superior because we don't touch the cornea, so your cornea can be elongated, it can be oval in shape or whatever shape it is. It still will not cause any disturbance at all. So in terms of the quality of vision, I would say that would be my number one apa namanya, things that I would like to emphasize, that it can actually maintain uh, close, because it is an implant still, very close to whatever that you're having or whatever you're seeing with your glasses or contact lenses before the surgery.
All right. Very, very thoroughly explained, doctor. Thank you for that. Right. Post surgery, right? Post a phakic intraocular implants. What is the typical patient experience that you could share with us, doctor? What a patient go through
Mm.
after an implant?
Yeah. I'm actually very elated every time people ask, how the patients behave or their experience. I don't know what they feel. I only know what I did. So,
Definitely,
but
yeah.
yeah, but generally speaking, the complaints only come during the first few days.
Okay.
Of course, for some people who are really very anxious, they can't sit still, they hold their breath, they were like, popping out the eyes, and you can't, they freeze during the surgery.
Yeah.
That's when we call it the verbal anesthesia comes into play. You got to calm them down, relax and things like that. Because if they hold their breath, they will be pushing everything out where we are going to put things into the eye. So that's going to be a bit of a gado there, yeah. But by and large, I've got so many success stories to share. I can't be sharing with you all because I'm not the one who actually experienced being done on me.
Okay.
And yeah, we have actually picked one of my many patients.
Mm-hmm.
And this girl, I say girl, she will scold me if I call her a girl. Very bubbly young fella, very, loves outdoor activities, still at the peak of her life, very healthy, of course, and she likes to ride the motorbike. So I would like to introduce to her Miss Tengku Atia for her to share her experience. And you can actually ask her what she feels or what I did, and things that maybe she didn't want to tell me, and then you can just
All right,
be
ladies and
honest
gentlemen,
about it. Yes.
let's welcome our special guest who has experienced the benefits of phakic intraocular implants firsthand. Right, let's welcome Tengku Nuratia. Hello, Tengku, how
How
are
are
you?
you? I'm good.
All right. So you are looking at us in a 24/7 clear version, correct?
Yeah, well, second makeup process.
Right.
It's working
So to
since day
start,
one, yeah.
right? Because we also want to know your experiences and the things that you experienced post surgery and how is your life right now and all. So to start, can you tell us first and foremost why you decided to choose phakic intraocular implants over other options like LASIK, lens, wearing lens, glasses, and also what made you decide you want to proceed with phakic?
Actually, my first choice is LASIK. My
Okay.
very first choice at the age of 20s.
Mm-hmm.
So I went to the doctor. I went to her. So uh get an examination and all. So my cornea is too thin for
Mm-hmm.
LASIK
Mm-hmm.
because my power is quite high. It's 700 on the right side, 650 for the left side.
Okay.
It's too risky for LASIK
Mm.
or lazy actually. So yeah, one of my wish list also been wearing glasses for like 20 over years
Since which age?
since standard one, seven
Since
years old.
7 years old.
7 years old. 7 years old, I'm with blurry image. Went home, told my mom, cannot see anything because I have to sit in front, still cannot see anything. So yeah, glasses is I cannot wear lenses because it's uncomfortable for me
Yep.
because
Yep.
my power is too high. So
Correct.
yeah, that's why I choose IPCL.
I think after so many years, finally you have a clear vision.
Yes, finally, finally, I'm
You,
glad.
you see, that's the problem. You see, if you hear correctly, she started at standard one, and that's 7 years old, and that is
Yeah.
practically the problem that we have for children nowadays in our country. Definitely,
Mm-hmm.
younger and younger children needing uh,
Correct.
glasses. Last time we used to blame it on the genes, yeah, genetic factor. Our parents wear glasses, children will wear glasses. Yeah, to a certain extent, yes, but nowadays it's no more just the genetic,
Mm.
it's more the lifestyle. That's why we call it a lifestyle hazard now. What is the hazard? Is actually the handphone. So
Mm.
we want to keep these children quiet. We will give them the gadgets, be
Yep.
it handphone, the tablets, iPad, you name it. Yeah, you just on the thing and then they will just keep quiet for 10 hours, no sound at all. Very
Exactly.
convenient for us, but it's a no for them actually.
Yeah.
So I would also like to take this opportunity to remind, especially young parents, like yourself soon, and yourself, that do not start gadgets with the children before the age of 6 if you can. Yeah.
Right.
No, no, no. Yeah, but I have seen people putting babies in the bassinets, facing the TV with this nursery rhyme going on. I say, why are you trying to, teach? The child can't even see anything. It's still black and white there. So you want a child to speak at, like 2 months old to be able to speak. You're not achieving anything here, but actually having a reverse effect on the children. So please go slow on the gadgets and they don't actually need these gadgets to grow up, get them to be physically active. I'm an eye surgeon, but that's my job to take care of the eyes. But no, don't start them too early because at the end of the day, you're gonna have to suffer, and later on have to cough out some more money to get things done to rectify the problem, which was just you know free of charge. Don't have to buy phone. You can actually save a bit of money there as well. Yeah.
All right, I think that's a brilliant point, Doctor. Thank you for sharing. Right, coming back to Tengku, right? How would you describe the procedure? Because the doctor did mention, give us a little bit of glimpse of the experience and all, but we want to hear firsthand from you. How was the procedure for you? Could you describe it? Like, was it quick, painless? Easier? Your expectation was that? Let us know.
My expectation. Basically, I thought it will take around the whole day. Maybe. I don't know because it's my
Yeah, yeah,
first,
yeah.
yeah. So 1 hour, 1 hour pre-op, 1 hour for my people to dilate,
Mm-hmm.
half an hour for both eyes. The
Okay.
the surgery is 30 minutes for both eyes. Yeah,
It took
so
you 30 minutes for both eyes.
both eyes.
Okay.
It's that fast.
Okay, quite quick.
Yes,
Yeah.
as people lah, if I say painless, because you might feel a little pressure on the eye while the deep hurting. So
Mm.
yeah, that's all. 30 minutes for the surgeries. 1 hour for observation, and I can go home after that. Happy.
All right, that's
The
great.
sensation might actually come during the stage
Yeah.
where we tuck the legs of the lens under the iris, because iris is very sensitive. So you
Mm,
can actually feel a little bit there. And especially if you are very anxious, you
mhm.
can you kind of be a little bit more hypersensitive
Mm,
because of that. So it's best to be relaxed, in a relaxed condition for the surgery. If you really, really can't do it under local anesthesia, we can actually do it under sedation or even GA. But that's, if you can finish it within 20 minutes or half an hour, no point taking the risk of general
yeah,
anesthesia, isn't it? Yeah. We
correct.
normally would chit chat, through the procedure. The chit chat takes longer than the actual
Yes,
procedure.
yes, agree. I agree.
All right. Thank you. To conclude, right? How has your life changed since getting IPCL implants, and what differences have you noticed in your day-to-day life? How things have improved for you?
I think my life has changed so much because I used to limit my activities before. I have to limit everything because I used to play hockey, I used to play ball,
Mm.
uh,
Very
from
active
younger
in terms of
age.
sports.
I'm very active. I'm
Okay.
very active. So I ride motorcycles from the age of 16 when I first get my license, wearing helmets with glasses. Imagine
Tell
because
me about it.
sometimes,
Yeah.
yeah, because if it's raining, then it gets foggy. So
Mm.
I have to take a rest for a while, clean my glasses and all. So I like swimming too. I love the island. I love the ocean actually. I love
Okay.
to do scuba diving, and so yeah, I have to I have to take off my glasses. Cannot see clearer in the water.
Okay.
So now, yeah,
Now a bit
everything changed.
better. Now way
Yeah,
better.
everything I can do everything.
Okay.
Mm.
Right. So I think we have some questions from Facebook. So let's take a few questions. Then we can conclude. All right. So this is directed to doctor. I
Yeah.
had LASIK surgery 10 years ago, and now I feel my eyes are very dry and I have blurry vision for only at night. So do I need another LASIK, or is there any other alternative to this, doctor?
Yeah, post LASIK patients, normally in our center, we don't actually discharge them off, as in we don't really like, "Yeah, okay, you go on with your life, don't come back anymore." We do follow up every yearly, yeah, once a year, because we do need to help you get rid or overcome any of the problems that you might be facing. Because now, sometimes it's not because of the surgery. Yeah. Normally the what do you call that? The disturbances in your vision, dry eyes, and things like that tend to be temporary. A few months down the line, yeah, and then it should be okay. But you have to remember now that everybody is on gadget, like the screen time. So it's not fair to just blame it on the surgery, but the screen time is actually high. So we do need to see how much of residual power that you have, and then the condition of the cornea. Yeah, whether or not you have this dry eye issues, or whether it depends on what procedure you had done, whether it's LASIK, as in with the flap, or whether it is the surface ablation, or is it because of or whether it is a relaxed smile. So these three procedures will give you different sort of a problem. So we
Okay.
do need to see how much of balance or residual power that you have, and is there any other problems that may attribute to your, symptoms lah. So whether or not you need to have a retreatment done, uh, we will have to depend on whatever that we find during the assessment. Now, sometimes it's not because of the power that you're getting back, but it's just because of the dry eyes. So it's actually manageable or treatable with just, frequent use of artificial tears, and then be wary of your screen time.
Right.
If it's akin to no driving from Johor Bahru to Bukit Kayu Hitam non-stop, right? You and your gadgets, right? So you do have, that's the reason for the RNR to be there along the way. So after 1 or 2 hours continuously on the gadgets, you got to take a break. Take 5, no time, 2 minutes will do. Just take your
But
eyes off, but
few minutes, just a
the
few
problem
minutes.
the problem is when you take your eyes off the PC or the laptop, you go to the handphone.
You got your phone.
Yeah,
There's
that
no
means
break there.
you are resting your body and your mind, but not your eyes. You're talking about the eyes here, huh? So at the end of the day, you find that two things that will happen to the eyes. Number one is it gets tired because you have always been, forcing it to do near work. That's why you see when you want to look far, it will take some time for you to get focused. Yeah.
Correct.
Number two is because of the dryness. When you focus, especially people who work with numbers, yeah, the bankers, the finance girls, and then of course documents, no, 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 lawyers, the document reading and things like that. So you don't, when you focus, you don't want to miss anything, right? You don't blink as frequent as you should be. I'm not asking you to keep blinking and then having this, habit of flickering your eyelids. No,
Even
but
I'm trying to blink right now.
so with the mascara on board, with the eyeshadows and things like that. So you don't actually naturally don't blink because you're focusing on things. So because of that, and you're in an air conditioned room, and in fact, when you're in a bigger organization, the aircon is just like horrible, isn't it?
Yeah.
And air condition is really very drying to the
Okay.
surface of the eye. And that is the one that is giving you the symptoms of dry eye. So two things that if you have not been putting your dry eye, I mean the artificial tears to moisten the eye up, and you don't take breaks, definitely at the end of the day, you're going to have a lot of
This
trouble. Can't
is
see the plate number of the car in front of you, nighttime, no, everything gets glary. It always comes at night. Nothing mystical about it. It's just that the eyes are dry because
okay.
you're, yeah, overusing it during the day. Yeah.
Okay. Nicely put, doctor. All right. Questions to Tengku. What was your experience like on the day of the surgery? Like in terms of what you immediately felt after the surgery, and how soon you noticed any improvement in your vision after the surgery? Tengku?
After the surgery, the whole day after, because I went out like for 3 hours, one,
Mm-hmm.
1 hour, yeah. And then after that, you'll see glare. It's
Okay.
only glare. And then you have to wear sunglasses, whether it's in outside the house or inside the house. Then you have to protect your eyes also.
Mm-hmm.
Keep moisturizing your eyes because you
Mm-hmm.
cannot get it's glaring, and then
Mm-hmm.
also it's drying. It dry. It dried so fast, so you have to put always the what do you call
Artificial.
artificial tears. Sorry,
Yes,
yeah.
yeah.
So my story is a bit funny because the next day I went to work actually. Yeah, because it's I have glares, but then I can see clearer.
It was manageable for you, I
Yeah,
guess.
yeah, yeah. It's manageable for me. I think it depends on people lah.
Yep.
It depends on your lifestyle also. I ride bikes, I ride motorcycle to work. But then extra, extra security there. I have to wear sunglasses, I have to wear, take down the visors and all. So yeah, it depends actually. The
Okay.
second day I went to job. Yeah.
Naughty,
I think that
naughty.
explains your experience of going through Phakic, yes.
Yeah,
So I
one of my naughty patients here. Yeah, you can't sit still.
Keras kepala.
Ah,
all right. There's one final question from Stephanie. IPCL can correct astig and myopia? Myopia, yeah.
yes, yes. Like I said earlier, this can be used for both. It's either myopia or hyperopia. Yeah, myopia means you're short-sighted, far tak nampak, blur, and nearsightedness. I mean, far-sightedness is near is a little bit difficult, right? It is also used for treatment of astigmatism, and that's what we call toric lenses. So you can have a myopic toric or hyperopic toric. And now, if you are above 40, like me, I'm way above 40, so you have reading problem. So you're going to have a presbyopia lens uh, but incorporated into that. So it can actually now treat all these three. Yeah. And the range of treatment is actually quite big. So you can have whatever type of, combination of refractive errors it can be done.
All right.
Uh,
Just one final question. Difference between MPL lens and IPCL lens.
Difference between M-
MPL, Medeum phakic lens, and IPCL lens, implantable phakic contact lens.
I don't get it. Medianium?
Yeah,
Medianium, huh?
yeah.
Medianium was a
MPL.
multifocal lens implant.
Come again?
Is that multifocal lens implant or medium? Sorry, I don't understand this medianium lens implant.
It's MEDENNIUM, Medeum phakic lens.
Medianium. I'm so sorry. I'm not aware of that. But
Okay.
yeah, is that a phakic intraocular lens implant as well?
Medeum posterior chamber phakic refractive lens.
Posterior.
Medeum posterior chamber phakic refractive lens.
Oh, and that would
If you're
probably
not
be,
aware, it's okay, doctor.
yeah,
No
yeah.
worries.
I think that would be maybe one of the other design of the lens to help correct the refractive error as well. Yeah.
All right.
Medallion picking. Okay, okay. Right.
All
Yeah,
right. So no worries, doctor.
yeah.
I think you shared really enough about phakic and this implants and all, and it really enlightened us. So thank you so much, Dr. Norazlina, for sharing your expertise and experiences and all. And a big thank you to our Tengku Noratia as well for sharing your story. That will give us, people who are watching so much of confidence. So it's been an enlightening section, and to everyone who's watching as well, I hope you learned the benefit of phakic intraocular implants and how they are actually revolutionizing the vision correction. All right, and to everyone who joined us today's conversation, if you have any further questions or if you'd like to learn more, do not hesitate to reach out to KPJ Center for Sight. And in celebration of Malaysia Day, KPJ Center for Sight, they are offering a special promotion on their advanced laser procedures designed to bring greater convenience to your daily life. All right, the website link will be shared in the comment section for you. Right, so remember, your vision is important and exploring your options can make all the differences. All right, so with that, ladies and gentlemen, have a great day. It's been a pleasure talking to Dr. and Tengku. Thank you so much once again, and have a great day, everybody. See you next time.
Thank you for having us.